Very good. Well, hi everyone. This is Majdi Hamarshi from PAMA. I'm the chairman of the board of directors of PAMA. We are having a session like previous two sessions we had before about a meeting with our medical mission members who went to Gaza and came back, and they will share their experiences with you. It will be a very, very interesting discussion. So I encourage you to listen to the whole thing. So I have with me Dr. Amr Afani, Dr. Muhammad Jagbir, and Amani Kanaan. I will let them introduce themselves to you, and then we'll go from there. Amr, go ahead.
Assalamu alaikum. My name is Amr Afana. I'm a trauma surgeon in Toledo, Ohio. I was born and raised in Detroit, Michigan, so I stayed around in the area, and I was fortunate enough to go on the March 25th mission with PAMA.
Dr. Jagbir.
Assalamu alaikum, everyone. My name is Mohammed Jagbir. I'm a pulmonologist intensivist. I work in Amman, Jordan, the King Hussein Cancer Center. I went with Amr and Imani on the 25th of March mission for 2 weeks in Gaza with PAMA and Jaffa.
Very good. Amani.
Assalamu alaikum. My name is Amani Kanaan. I'm a physical therapist and a licensed practitioner nurse. I was fortunate to join PAMA to be on the mission trip of March 25th.
Awesome. Well, so for our viewers who don't know, so this was the fourth medical mission. PAMA, JABA, the Jordanian American medical physician, along with PAMA, the Palestinian American medical physicians, they have sent medical missions to Gaza. The first one was in January, then February, and we have two in March. That was the second one on March 25th. And our team spent 2 weeks in Gaza, and they spent it at the European General Hospital, which is in Rafah area. So we're going to be talking to our team who came back from Gaza, and they had their time to rest and settle back in their work and in their life. And now we'll try to shed the light on some of the experiences they had in Gaza. Well, first of all, I want to start with you, Amr. How did you come to know about this medical mission? So people are curious. I want to go on a medical mission like Dr. Afani and Dr. Jagbir and everyone. So how did you know about it? Was it like a special connection? Was it? How did you know about the mission?
Yeah, so ever since this conflict began, I was kind of looking for ways to help. And I'm aware of Palestinian American Medical Association. You guys are pretty active in Toledo. And then I did receive an email about signing up, and this was like in the beginning phases before I think you even knew how you guys were going to get there. So I signed up, and then there was also an email out through the Society of Critical Care Medicine that they were calling on volunteers. So I heard about it again from there, and that was, I think, back in November. It was pretty early on. I want to say November or December.
Yeah.
Yeah.
True at the beginning, and we're very proud of our partnership with the Society of Critical Care Medicine. We made a call for volunteer, we call it, and they responded very well. They forwarded an email from SCCM and PAMA, and we have 1,000 SCCM members who have signed up to go to Gaza with PAMA. We're very proud of this partnership. But yeah, Dr. Jagbir, how did you hear about the mission?
MashaAllah, it's great numbers you just mentioned, more than 1,000. I'm going to quote that actually in many conversations I'm going to have about this.
True. Yep.
Yeah, somewhat same track. I'm an SCCM member, active, pretty much active. I got that email, and the story behind it. So when I signed up, we start forming kind of a small group on WhatsApp saying that we're going to go. We're going to do this. And early on, we were waiting for the ceasefire, which never happened, unfortunately. So after that, we decided to start going with missions. And I told them I'm going to go on the next one. Reaching out to PAMA and Japa leadership were very supportive. And I signed up for the March 25th mission, alhamdulillah. And it was a great thing to do.
How about you, Amani?
Just like my colleagues and my friends have said, the same thing. Like the desire has been there, and it was just such a need, like to be there helping others and knowing relief a little bit of the pain or whatever suffering that people are going there, And I've reached out to a lot of my friends and my family, and I've asked of ways. And Rana was very supportive. She's been on Rana Mahmoud, she's been on medical trips before with PAMA. So she's connected me with the right link and the people to get signed up for the mission.
And definitely. And again, in PAMA, we cannot thank you enough. And we cannot thank all of those who participated in missions or signed up for future missions. We appreciate that volunteerism. You know, it's no secret. You are risking your lives. I mean, and you are saying goodbye to your families. And we did not guarantee, and you did not guarantee, it was in the hands of God that you don't know what will happen in Gaza. And invading Rafah is always imminent and the threat. And despite that, you guys signed up, you went, and you never hesitated. And you helped, you've been with the people of Gaza. We highly appreciate what you do. So how about Dr. Jagbir, what was, when you went in Gaza the first time, like you crossed, it's a long journey. I know, like people might not know, from Cairo to Rafah crossing, lots of checkpoints and stops and all that. But let's say you made it, you persevered and all that, but then you went in Gaza. Now you are in Gaza. What was the first thing that like took your attention, or like you shocked you, or what was your first observation, first impression?
Yeah, I would say the first really strong feeling I had in the trip was when we saw "Welcome to State of Palestine," "Welcome to Dawlat Palestine." That was a very, very unique feeling I've almost never had in my life, short of visiting Kaaba in Mecca, maybe. It was really a good feeling. And I still look at my passport and look at that date. It's really a great feeling. When we went in, I mean, you didn't know what to expect. We actually went in, it was after sunset, so it was dark. So there's no electricity. You would see people like ghosts walking in the street. There's like abandoned cars and piles of garbage here and there. So you don't know what to expect until we hit the area of Gaza European Hospital, where you have a lot of people there just, for safety, hanging around the hospital. And then you start realizing this is where the action is. This is where we're going to be at. Um, you know, we I'm gonna be honest with you, I had maybe more worry or anxiety, if any, before I went than when I was actually in the trip. Having a group of people around you was great. Seeing the people of Gaza itself was amazing. They're all just so comfortable and have good faith that you just become part of that group, become part of that vibe. So that was, I would say, the initial strong feelings I had about the trip.
Amir, how about you?
Yeah, I think the first feeling was a feeling of overwhelming relief because, like as you said, the trip is very long. And you're kind of worried, are we gonna be able to get in? Is this gonna happen? And then finally, when we arrived, I just felt this overwhelming feeling of relief and gratefulness that I was there finally. And I've never been to Gaza. I've been to the West Bank, where my family originally is from, but I felt like I was home. So it was a great feeling. After that, the next thing you notice when we stepped out of the entrance area, the first thing you notice is the sound of the drone. It's overhead pretty much all hours of the day, and you notice that first. And then the people, they know we're coming as a medical mission. People know we're coming to help, and everybody was very kind and just excited to see us, even just in the area where we were getting our luggage. So, and then I would, just like Mohammed said, when you're driving the 10-minute drive to the hospital, that's kind of the tricky part. Obviously, you're in a car, you're in an ambulance going to the hospital. We got a deconflicting order to make that drive basically to the hospital. You can't see anything in the dark because there's no power. So we couldn't see any houses or any people. It was like very dark. You can see silhouettes here and there. And then you get to European Gaza Hospital and it just dawns on you like there's an entire city here, within the small hospital walls. And then once the step out of the ambulance, you just get mobbed by all these children coming excited to see you, and it's quite an experience.
Amani, what was your first impression?
I think like for me, it was a little shocking before I've entered Gaza was the amount of truck aids that were parked on the side and like not being able to enter. And then once we entered in there, I tell you the truth, I felt very thankful and a lot of gratitude just for being there and the right time to help people. And I was able to finally step into Gaza. That was a very overwhelming feeling of just gratitude. Also, like the people just also the one thing that I feel like was very um, like eye-opening for me that I didn't see on the news was a lot of the tents that were around the hospital and the amount of people that lived inside the hospital. That was very shocking. I never just saw anything like that. And the
Yeah,
welcoming of the children.
yep. Keep going.
Yeah, the children were very welcoming. And I'm a Palestinian, a Muslim. I just, don't like you could look at me, people would guess I'm Latino, but the kids were over like they greet you by hello, hello to everybody. And I
Yeah.
just asked because I was curious, like, why you guys don't say salam alaikum? Like we're all Arab, we speak Arabic, some of us, and they said, well, because a lot of the mission trips that came are like a lot of people were like, different Europeans or Americans and whatever. So they were very kind and welcoming to see somebody like from them, like that felt family supporting them and being there for them.
Yeah, people don't know that around the European General Hospital, which is one of the 36 hospitals in Gaza that used to be, and now we have only 5 or 6 hospitals that are barely operational, including European General Hospital, which is in the south part of Gaza. And it is a small hospital when you compare it to a Shifa or Nasser. The big ones are gone, destroyed, unfortunately. And that European hospital is like trying to catch up and operating at 300, 400% capacity. But people didn't know that around it and in it, there are about 13,000 people taking refuge, lining the hallways of the hospital and mounting tents around the hospital. And I'm going in June, and you are guys painting a picture for me, and I'm waiting to go and see that. And I hope it will not be there by the time. I don't want to hope that I hope things will change from here to June to the better. So, but yeah, inshallah. But no, definitely, Amani, like what you're describing also about the people of Gaza, that they are used to the international to come and interact with them. So one like some people asked Maggie, Maggie Ogden, she was on the second mission, I think. Maggie is a blonde American girl, and people were asking her, "Did you feel safe there?" I mean, and I understand where the question is coming from. People can take offense to it, but people of Gaza are used to all kinds of people, and they are humans like all of us, and they will welcome us. We are going there to extend a hand to them. They are friendly. They love life. They have dignity, and they welcome everyone. So, Amir, what was your role in the mission? Like, what was your part? What did you do there?
Yeah, so I'm double boarded in general surgery and surgical critical care. So as a trauma surgeon, I can fill in many different roles around the hospital. I tried to provide some trauma care in the emergency room. So I'd help evaluating the patients when they came in with resuscitation. I also any abdominal trauma or thoracic trauma that came in, I'm able to take care of that. So some operations, and also we would round in the ICUs and on the wards and try to help with any surgical issues on the different wards. And then I also helped with wound care. There's lots of wounds, unfortunately, at this phase in this conflict, a lot of the patients have chronic wounds or non-healing wounds from earlier on that need to be addressed. So I did help a lot with wound care, and that's basically it. Mostly, just trying to move around between the different areas of the hospital and try to help, however I could, whether it be in the ORs, the ICUs, or in the ER.
Amani, how about you?
Oh, I kind of pretty much did a lot of things, but one of the biggest thing was I was shocked the amount of people that needed like therapy. There was like people stopping me everywhere in the hallways, like if like with so many injuries, like it could be from as little as fine motor coordination because of a ulnar, nerve injury that they got, or it could be like an amputee. It could be a lot of people developing bed wounds because there's lack of assistive device and wheelchairs and walkers to get up. So they've been in bed for so long. I've also helped a little bit in wound care. I helped Wafa and Rana with their group. I've also tried to provide little groups of like a little bit of mental support for people to kind of like talk and provide them in just like journaling or direct them into activities to kind of release a little bit of the stress along of like just being there to translate sometimes for like Dr. Mark in the operation room. I tried to be as much active as I could in going around the tents and the community to see the needs of the people and the bigger picture that we don't see on social media, and where they lack, what are the things that they're suffering, the real picture of the situation over there.
Yeah, and I know Dr. Jagbir is breaking his fast. So he is a pulmonary critical care, and he was in the ICU at the European General Hospital, along with another physician, Dr. Zuhul. So
another thing,
yeah,
just if I may, that our group did that I thought was very helpful was we provided some education to the medical students there. One thing that people should know is since this began, the medical students have not gotten any education. Many of them are displaced themselves, and we met many medical students who were just volunteers at the hospital, just trying to do something, trying to learn something. Many of them were on different teams in the hospital and were members of like the neurosurgery team or the plastics team, for example. So we tried to give some daily lectures to the medical students while we were there, and I think they appreciated it a lot.
No,
Yes.
thank you, Amr. Yeah, thank you for shedding the light on that. And I think that is a nice segue to my next part of this discussion, that now we know who you are and what you've done during your mission, and you all stayed there for 2 weeks. I'm gonna describe the situation a little bit, and then we can take different parts of it. I have the advantage of watching so far from outside, and I'm coordinating the medical mission. So I'm the one who's reaching out to you, sending you emails, getting the team together, and with PAMA team, coordinating with the WHO and getting the team to Gaza and talking to the hospital in Gaza, what you need, what can we do, how can we help, how can we impactful, come back and celebrate the success of each mission. But I want to say and make it clear that what PAMA is doing is important. What all charities are doing is important by sending medical missions. But what we are doing is only a band-aid on a big, big wound that is expanding in front of our eyes, and the band-aid is not gonna suffice. We are aware of that. We are aware of that, but we cannot help it not to provide the band-aid. So people need to understand that the situation is way worse than a medical mission can handle. And we can approach that from different aspects. I want to start with one aspect, and then we'll take it to next level. My part, I am involved in coordinating medical missions. Someone might look from outside and say, well, so you are being allowed to go in Gaza, and this is nice. So these are doctors being allowed to go to European hospital. Yes, that is true, but so just to explain how we get in Gaza, because many people ask, how come you get in Gaza? Like nobody's getting there. So now many charities managed to get in Gaza. The first 3 months of the war, nobody got in. January, after a UN resolution, WHO was assigned to get people in Gaza, and finally, the Israeli authorities agreed to collaborate with the WHO. So people don't know that each medical mission goes through Rafah crossing. We have to have the blessing of the Egyptian authorities and the Israeli authorities, both. and we can be denied from either one. And the Gaza hospitals, they provide their need. They say, this is what we want, this is what we need, this is how many we can accommodate. So between these three parties, the mission will shape. So we will send, let's say, 10 members, medical mission. Now, why can't we send more? Well, two reasons. Gaza cannot accommodate more than 10 in the hospital. It is not safe to live outside the hospital. And there's a term we keep saying, deconflicting order. What that means, basically, when our team moves from Rafah to the hospital, or from the hospital to anywhere and back to the hospital, we have to inform the WHO, the OCHA, we call it, which is part of the UN, and they coordinate with the Israeli authorities, and they coordinate back and say, yes, move now, and so on. And this can fail, and we all have seen what had happened with the World Central Kitchen. A deconflicting order did not provide the safety that we were looking for. So what I'm trying to say, we are limited on the number of people we can send every mission. And I hope the borders will just open and we can send 100 physicians at a time. I can't. I have 100 physicians who are willing to go tomorrow to Gaza, but we can't. And now we are being told, and it's not official, that the numbers are going to be decreased. And this is by authorities, that we need to limit the numbers who can go in Gaza. So that's one limitation. That's one problem, that we need more people to go and we can't. But I wanna ask you about the situation at the European hospital, and why what we are providing is not enough and not adequate, and what really the people of Gaza need, and what really the hospitals of Gaza need. And I will start with you, Amir. What do you think about all that? And we can take the discussion from there.
Yeah, sure. So the situation at the hospital is catastrophic. I think we mentioned before, there's thousands of people that are taking refuge in this small area. You can't step anywhere around the hospital without there being a family and like living there. Even the stairwells, there's families living in the stairwells. The sanitation is a big issue in the area. The people are clean, but if you have thousands of people in one area, sanitation becomes an issue. So that is just the smell of all these people in one area is very noticeable. So sanitation is a big concern. The hospital itself, just being a surgeon, sterility, basically it's a luxury there. There's almost no sterility, and you can see that based on the amount of infections that occur post-operatively. I think infections is a huge problem there, and I think that comes into just the amount of people around, the lack of infection control, the lack of resources in providing sterility, for example. So that's a big issue. The hospital itself, you mentioned about sending doctors. Of course, doctors of every specialty I think are needed. But beyond that, the staff of the hospital, they have worked every single day for 6 months, many of them without any pay. They are exhausted. I mean, I saw the signs of burnout that I've never seen before. Like the nurses are so burned out, the OR staff. I spoke with a lot of staff around the hospital, and they appreciate us being there so much, but they would even say, like, bring staff, bring people to relieve us, because they're so exhausted. And that was tough to see. The other thing I would say is a lot of people have had to step up. So an ICU nurse may not be a real ICU nurse. They may be someone who was in nursing school. The person who's closing lacerations and doing resuscitation, early care for a trauma patient, they might be a medical student. So just the people there are doing their duty as best they can, but they are burned out, they're exhausted. And many of them are suffering too outside of the hospital. A lot of them that I met had lost everything as well. So, but they still show up. There was an anesthesiologist even who lost his family, and he showed up to work. So that was kind of sad to see, but also, I took some inspiration from it as well. But to go beyond the hospital, you know, and I'll let somebody else weigh in too, but just basic things like labs unavailable most of the time. Chest x-rays are difficult to obtain. The CT scanner was broken half the time. So the hospital's under tremendous stress. But I'll let somebody else weigh in, so I'm not monopolizing the conversation.
Yeah, I don't want to make Amani to the last time. So how about Amani next time? And Dr. Jaghbir is going to be last on this. Yes, Amani, how disastrous the situation is, and we are being humble. Like medical missions, we are sending a medical mission, knowing we are basically making a little difference. It's a positive one, but the need is huge. How did you feel that yourself?
Like you said, you described it best. Like it felt like I was just a little dot in the ocean, a little band-aid over like a big traffic like injury. But it was just most likely that you felt like there was the lack of resources, the lack of basic, just like a basic thing, like a walker to get somebody up and walk as a physical therapist, or like somebody that had an amputation and needed just a shrink or stuff, like that wasn't available. So you had to just use, kind of accommodate and use whatever they have. It might not work and it might, but you really just have to work with what's there. Also, like just the infection was through the roof. Like there was just no way to keep it under control with the amount of people that lived there, and did just, you know, did their activities of daily living in the hospital in a little 4x4 space that might have maybe like a family of 8 living there, cooking and cleaning and doing everything they can to maintain the proper hygiene they need. It was, I think, like also the burnout of the people, like the physical therapy department that I went to had 9 employees left. A lot of them were, you know, targeted and injured, and some of them were misplaced with their families, and they had to leave by a certain amount of time because they had to stand in line to get water for their families. They had to stand in line to get food for their families. You know, they're just being there and trying to give a little bit of relief. That a little, you know, it's nothing really, but it just, you know, it could help. You know,
Sure. No, I hear you, Amani. Yeah, definitely. And you are echoing the burnout is a big thing, and people don't. I don't know if I'm sure they know, but we don't keep that fact alive. That ICU doctor we are going to help, or nurse, they might be themselves have lost a son, a daughter, a husband, a father. Definitely, there's no one in Gaza who did not lose one family member. They lost their house, they lost all their income, they are not being paid. They are worried about the remaining of their family living in a tent under rain, cold or hot, and they cannot provide for them. They're worried about them, and they leave the shift. They go try to help, and then they come back to their work, helping the patients. And they are doing that because that's who we are, healthcare workers. That's what we do. We don't abandon our patients. But this amount of stress, I looked at other disasters in the world. I've never come across that much stress on a healthcare worker in the world, and they kept going to their work. This is I think they owe us telling the world what they're going through, and what kind of heroes. And I can't understand how each of these healthcare workers in Gaza, they should be given Nobel Prize. They should be on all stages in the world. They should be applauded and welcomed, and in every ceremony in the world, they are the heroes. But I don't think they're looking for any recognition. They are only asking for one thing: stop the injury, stop the killing, ceasefire. Dr. Jaghbir, what do you think? What's your take on that?
Yeah, I could not agree more with all what you guys said. You know, I can share my experience as an intensivist. And as an intensivist, I'm sure as you know as well, Majdi, we're used to work part of the system. We're not in isolation. You work with the workflow, the ER, the floors, the surgeons, and so on. And all of that was actually under a lot of strain. You know, I always remember my second day there, and I think I mentioned that in the video. where it was only my second day, and they said, well, there's no labs today. And then I asked, okay, for a CT scan, because I had someone who has a suspected bleed, and they said the CT scan is not working today. So I ended up needing to work with physical examination. So I put my hand in the pulse and kind of sense how strong it is and things like that. And would do X-rays when you get them, because when there's no CT scan, now the X-ray is delayed because everybody wants an X-ray. We go to the floor, try to examine patients. Electricity is in and out. And I remember examining patients on cell phone night and talking to their families and trying to figure out a plan in the middle of that. So the system is, I always say, it's either collapsing or collapsed there, depending on how you look at it, between the people being burned out. The ICU
Yes.
for 6 months straight has been almost exclusively run by trainees, actually, who still in training, who need education, who need someone to talk to, someone to relief, and so on. They didn't have that for 6 months straight. And you would talk to them and you'd say, okay, you get a couple of days off, what do you do? And they will tell you, we actually spend at least a day putting our energy and thoughts and whatever money we have in getting resources for our families, like food and electricity and water and so on. And then that what blew my mind, and really a huge respect to them, a lot of them volunteer in other places in their days off. It's not only that they
Yes.
work in the European Gaza hospital, they're under a lot of strain. They actually, in whatever time off they have, they would go somewhere else to volunteer and continue working there. Because like they said, they believe that their message as healthcare workers don't stop. They know that no matter what stress they're under, other people still need them too. And they push through with that.
Yeah,
Sure.
I think like you
Yeah.
said, like the healthcare workers there do not get enough recognition. You know, I saw the best example of what a doctor or a nurse or anybody should be, you know, a medical student. I was talking to one of the ICU nurses there one night, a gentleman that was taking care of a patient we had operated on. And there's this overwhelming feeling there that maybe European Gaza Hospital is next, you know, because all these big centers have been destroyed. And so there's this feeling that maybe, you know, EGH is next. And I was talking to him about that. And he basically said, the, you know, leaving the hospital for him means leaving the patients. And he said, this is impossible. You know, I can't leave my patient. I won't leave my patient. And I think that's, you know, an example that you don't, you know, you hear about it, you know, in our training, they tell you like your responsibilities are to the patient first, but the people in Gaza are actually living it, you know, and they're showing the world like how to be a shining example, you know, but they don't get as much recognition
Yeah.
nearly enough.
And you're right. The heroes are not only the healthcare workers, the people, the patients, their families. I want to ask each of you, if you can, bring to your memories one example of an encounter you had. I know you have many. I know there are a lot, but the one that comes comes to you first, of a story that you want to tell on behalf of a patient or a Gazan or a boy, a girl you met, or one of your colleagues there. That shows, yes, we say the people of Gaza are strong, and by no doubt they are. I've been to Gaza. These people are strong. They are born strong, I believe, but also they've been through a lot. They've been through a lot, and they survive, and they always thrive, and they always stand again. They they don't surrender. They have dignity. They are humans. They love life, but also they have dignity, and they don't agree to be oppressed or sieged, and that they keep fighting back for their freedom. So, but I'm sure you encountered uh, some human stories. If you can bring to the attention of the audience uh, anyone you can remember, and I'm not going to name, and anyone who has anything can open the mic and share.
Yeah, maybe
Dalbir,
I'll start.
go
Yeah, maybe I'll
go for
start.
it. Yeah, go for yes.
I may actually share two stories just because there's this contrast there. The first one is a sad one to me, and still, and like you said, Majdi, there's a lot of stories really. And they keep coming to my mind all the time. But one that was really stuck to my mind was a young child who was maybe 2.5. You can never tell because there was no family, unfortunately, only survived by a grandfather. And it's a very sad story where the whole building went down because it was, a rocket hit it and for no clear reason. And this was the sole survivor of that attack. And the grandfather was away, so that's why he's still alive. And the reason why it's still in my mind, because although I'm an adult intensivist, I was really trying to stay as involved in his care as possible. I even one time intubated him, which I've never done for a child before, but because I felt like I want to do everything I can to help this young child. And unfortunately, we lost him after a week. Some say, he's finally relieved, he's in a better place, and I hear that. But I also, to me, it will always stay in my mind because I'm a father of four, Majdi, and I will. It's difficult to see a child suffering like that. So that's one story. The other one is actually maybe a better tone. It really speaks volumes about the people of Gaza. Was an older gentleman who had a liver cirrhosis and recurrent ascites, and he came to the ER. And maybe based on his daughter's story, he spent 3 hours waiting for someone to say hello to him in the ER because there's clearly priorities than drain an old man. And we forget about these things despite all the injuries we see, and there's still older people who have chronic diseases who need attention. So I told him, yeah, I'll help you out. I know how to drain an ascites. There's no paracentesis kit, clearly. So we had to get creative. And one of the residents taught me how to get three different things together to create the whole thing. So I was draining him and I was chatting with him, and he told me that they came from the north of Gaza. And he told me the only reason we came down here is the hunger. He didn't mention safety. He didn't mention, they're so stuck to their land. They're so in love with the feel that they belong there, that they wouldn't leave. And the only reason they left because of the hunger in the north, and they have children in the house. They could not stop crying. So that really and they told me about the trip, how they walked down on their feet, how they kind of stared, and did not show any weakness. And I had nothing but respect to them. And although he was thanking me, I felt like I shouldn't be thanked. I should be thanking him really for sharing all that with me and for letting me take care of him because he went through things that I cannot really imagine. And yet here he is telling me he wants to go back the second he gets. Just wanted to share this too.
No, appreciate that. And as you said, they give us the opportunity to serve. Every time I go to Gaza, I say thank you. They teach you life, and they give you the opportunity to enjoy your humanity. Can't say it better than what you said. Amir or Aman, you jump in. I don't want to put you on the spot.
I think one of the most difficult things about the trip was Dr. Jarbir alluded to it was the children. I think many of the patients that we took care of were kids. More than once, I heard people and staff members remark that they call this the war on children. Lots of the patients in the ICU were children. One particular case that is stuck in my mind because it kind of forces you to look at things in a certain way was this. I think the child was about 2 years old. She came in with burns on her chest and her arms because her mother was in their tent boiling some syrup for food. And this is obviously on the floor. And so the kid had access to it and burned herself. And, at first glance, somebody might say that this is not a war injury because it wasn't due to a missile strike, for example, or an explosion. But had this family not been displaced, had they been living at their house as opposed to living in a tent, this wouldn't have happened. So in my mind, even when this occurs, this child is burned now as a direct result, I think, of this conflict. And there's a lot of things like that not exactly war related, but suffering nonetheless.
I mean, the WHO put out a report about the consequences of war that we did not see yet. They're coming. Well, but we can't feel it minute to minute, hour to hour, day to day. But you're gonna see it down the road. And we are healthcare workers. Amani, you prepare your case. I'm gonna just give a little here break. So another group of people that we need to shed the light on, and they're gonna be affected by those consequences of war, are not only I'm gonna zoom in on the medical students, all university students in Gaza, all school children in Gaza. They have no life, no school, no academic life after the war stops. Like, let's say the war stopped tomorrow. All university students, they have no universities. People might not know that the strikes, the air strikes, destroyed all universities in Gaza. There are 2 medical schools in Gaza, Al-Azhar University and the IUG, the Islamic University of Gaza, both destroyed, leveled down. So they have no campus to go back to, no rooms, no nothing. And I don't know, I hope they have all the records in the cloud. And on a side note, PAMA is joining efforts to find a solution to the medical student problem. But this is an example of the consequences of war. I agree with you, Amir. That tent is a consequence of war, and that burn injury is a consequence of war. The same as the years those students going to be lose in their academic life till Gaza is built again. This is this is nothing but collective punishment. These are not my words. These are international human rights organizations saying this is collective punishment. This is illegal. So, Amani, you want to chime in on any human story you came across?
Yeah, so there was a lot of them, but the 2 that I can't stop thinking about was one that hit me most because it's my profession of also, you feel for the people that you kind of, you can see yourself in their situation. It's a physical therapist that have lost his leg due to a target. They targeted his home for unclarified reasons, and he lost all his family. He lost his 3 children, his mother, his father. He's the only one surviving. And he moved from Indonesia hospital to Shifa, then from the Shifa hospital to the Arabian hospital. And he's been volunteering with walking on crutches, trying to get there to help the patients and showing up for people. And just that's at a different level of being selfless, even you lost your home, you lost your, you're not even functioning as, he's functioning okay. He just adapted to it, but really he's missing a limb, and he's still showing up every day to help other people and check on the patients and try to comfort them. And really that just made me feel like I'd never felt like I did anything there. Even I tried to do my best. I just felt like I'm so grateful for this experience and what it's taught me and what it opened up my eye to a lot of things.
Yeah, compare between that who's volunteering, lost everything and still volunteering, and us, we have, alhamdulillah, we have the luxury of our safe houses, safe families. We are enjoying our financial security and all that. And we take an off day, off 2 weeks from our work. And then we go volunteer for 2 weeks. And how can you compare between us and that? Volunteer you're describing. I mean, comparison is not valid even. No, I tell you, that's how people of Gaza teach you life, teach you what it is. What we are doing is nothing compared to what they are doing. So I wanna move on, if I may, to action. What can we do more? What should the world do? If the world wanna listen to us, and we are healthcare providers, we are credible people, we are held always to high standards. We have no bias. We go there for the humanity cause, and we focused on patients and those who need help. And in our assessment, what Gaza needs, what should the world do to help the people of Gaza, taking into consideration, we're going to be mindful that this whole war, we are not naive. It started. We know Gaza is under siege for 17 years, and Palestinians under occupation for 56 years, and international human rights organization describing the situation of Palestinians as apartheid, and they have the right to resist oppressions, and all, we all understand that. But things escalated after October 7, and there have been hostages. And we are not here to provide political solutions, but we are mindful of all parties, and we have all the interest for those hostages to go back to their families. And I've been with the Congresswoman asking her for ceasefire. Like that, I'm doing my part in my city, in my district, trying to lobby for the Palestinian cause. I say people in Gaza need ceasefire. And then she will tell me, well, you need to release the hostages to cease the fire. Then my argument was, we need both, but I don't know about linking them timely together, if that is of equal humanity, like motive, because the ceasefire is needed to stop the killing of children, to stop the destruction, to stop overwhelming these hospitals, to give people a break. That is an active killing. Now the hostages being returned, yes, they need to go back to their families, but there's no active killing there. There is no human life lost there. So why we are equating both, as if you're saying, I'm gonna keep killing your children till you release the hostages. Morally, that's not consistent. And we try to be as moral as we can be, So that's why I personally believe ceasefire, permanent ceasefire is a must to relieve the people of Gaza, start looking how to recover everything that was damaged, and politicians will take care of what we need to do to release hostages and come up with political solution, all that, which that's not our job position. So I don't know what your take on that. What would you say to the world? What would you say to President Biden? We are U.S. citizens. What would you say to your congressman, woman? What would you say to your communities? Being there, the physician had firsthand experience in Gaza. I would say, Amani, you're going to go first this time.
I think, like you said, the biggest thing right now that they need is a ceasefire, because that's just going to eliminate a lot of other things, a lot of more farther damage than there is, and I don't think we can catch up on helping them, but it's just can eliminate a lot of the suffering and the pain and the losing of the lives and the homes and the schools and a lot of the things. So I think the biggest thing right now is the ceasefire.
Sure. And Jagbir, what do you think? How can we get to that? You live in an Arab country also, you do what you can. We don't want to get into politics, but what people can do everywhere, like other than voting, signing petitions, talking to politicians, speaking up, joining peaceful demonstrations and all that. What would you, being in Gaza, you went to Gaza and you want to shed the light on the importance of these things, because people forget with time, get numb with time. And the people of Gaza are still under the same killing machine. So, and we do want to forget that. So what would you say?
Yeah, so I'm gonna mention two things. The first one is because you cannot overstress this. It is ceasefire, really. There's nothing you can send all the doctors in the world. They can help for that time period. They can be there for their fellow healthcare workers, but it will not fix the healthcare system. It will not help us to rebuild and start actually doing a meaningful impact without a ceasefire. I would argue back to that Congresswoman or anyone who have the same argument, that these are human beings who are on the side of this. These are not collateral damage. They're human beings who just live there. And I would challenge anyone. And I lived in the U.S. for 14 years. I live in Jordan now. Anyone who lived here or there to go in Gaza and live more than a week in the same conditions and keep it, together. So we need to think of them the way we think of ourselves. That's one. As far as what else can people do, especially, anywhere really, is peaceful demonstration. Being in Gaza, people, once they know I'm from Jordan, they will be happy. They will tell me the things we see on the news, is that real, these demonstrations, and that will help support them. That will make them feel that they have people who actually still think of them and care about them. The news that come from the US these days, what these college kids are doing in big universities, same thing. It's the least we can do to get the voice out, to be vocal about it, not to be silent, because it's not something to be quiet about. So I would stress these 2 points, which is ceasefire there, because that's the only way I see to make a meaningful impact in Gaza. And till we get there, is to be vocal about it. So the way we are now, to support them, at least the least we can do.
Amir.
Yeah, I mean, number one, like everybody said, a permanent ceasefire. I think one of the realities I realized very quickly, you know, when a missile strikes a house, a building with 40 people in there, you know, you would think you're going to get a lot of trauma patients to the hospital, but the reality is most of these people end up dying in the rubble. They don't make it to the hospital. These aren't survivable injuries. So until there's this bombardment stops, the situation, no matter what we send, is not going to get better. So that's number one. I think number two, and that's a very long discussion, is the rebuilding of Gaza. You know, that's going to be a huge undertaking that's going to require everybody, anybody and everybody around the world, no matter what their specialty or focus of work is, there's a role to be played there. Um, uh, you know, past that, I'll tell you like what people can do here. I think one of the most disappointing things for me as a physician in the United States has been the response of American medical associations. This is a conflict that's seen the healthcare system absolutely decimated in Gaza. Hospital after hospital has been destroyed, but we don't hear anything from our medical organizations that we're a part of. And I question why. You know, why is that? And there, you know, I've emailed and I've asked, and to be quite honest, I haven't received an answer yet. And I think as a U.S. physician, and we claim that we have the highest morals and we have the ethical standards, I would ask, you know, physicians here should pressure the organizations that represent them. You know, why aren't we speaking up about this? Why is this normalized now? And I think this conflict has set a very dangerous precedent that, you know, if there's a conflict, it's okay to destroy hospitals and kill patients and kill children. And I think this hypocrisy needs to be dealt with, you know, because it's set a very low precedent. That's been very upsetting, you know, for me.
No, I think you're very right, and this is a very important aspect what we physicians can do. I think we need to reach out. I think we need to reach out as you've done to our organizations, our bodies, and to make a statement. I don't think we can isolate ourselves from this. This is the world is a small village now with the technology, and everybody's seeing the news. And I know how can I distance myself from my uh, like colleague who is a critical care doctor in a European hospital. I know I went to a Shifa hospital and I met three critical care doctors there. Two of them are detained now, okay, after the recent raid in a Shifa hospital. The third one has been displaced, and I've sent messages and they don't go through. So I need to know how he's doing. And these are my colleagues. And you're telling me about the ICU at the European hospital is being run by trainees. So how come I'm okay with that? And I think we need to see a better response from the medical communities in the US, calling for ceasefire, calling to restore the healthcare system in Gaza and do what they can to help. I totally agree with that. Any like lasting comments? Any other aspects you guys want to discuss or shed the light on that we did not cover with our discussion?
No, I just want to say one last thing, maybe, that the people of Gaza were much stronger than I thought. You know, you always hear about it, and they tell you, don't call us superhumans. We don't like that because we're humans like you. We look for the things that you guys look. We want to live a good life and so on. But you cannot not say that. Really, they taught me a lot. I always say I've benefited more from this trip than I think I benefited them. You know, from my presence. I learned more about myself. I recalibrated my you know, my compass and my calibers, and I feel better as a human just because of being there for 2 weeks. So I think I want to
Definitely.
make sure that I mention that.
No, I thank you for saying that, and I think you are accurate. And I gave a speech at a recent PAMA dinner. I was very careful. We always I believe they are very strong people. I've never seen, and not only that, they are very faithful. I think their strength is coming from their faith. They do what they can, but they accept everything from God. And I've never seen anyone who's losing his child or daughter, and the first thing they do, they just pray to God, thank God and they accept what God have given them or taken from them. So I've never seen such a strong faith, and I think that the strength is coming from their faith, and this is something to learn from. And I have children. I can't see the scenes of children. I read, I educate myself. I need to be involved, but I cannot see the scene itself. And I'm going to Gaza next again in June, and I'm being told the ICUs there are different. I'm used to an ICU here that is medical ICU. We have a trauma patients, and our trauma colleagues take care of them. So I don't even if I go to neurosurgical ICU, I need to read a lot before I go there, or I go to CV ICU. Or so now you're telling me in one ICU you have a child and adult. You have burn, you have trauma, you have neurosurgery, you have medical condition, DKA, and you have all that in one ICU. And we're gonna take care of that. So I have a lot of reading to do before I go to Gaza, and I will learn there, I'm sure, and I will try to save lives as much as I can with the knowledge we have. But definitely, the people of Gaza are very strong and very faithful people, and they taught me. I changed after I went to Gaza. I became a different person. Like I've been there twice on medical missions now, and I'm a different person. I've been doing PAMA before I went to Gaza, and because I'm connected to Gaza and what's going on, it's unfair, and to Palestinians in general. And again, I call this war it's a Israeli-Palestinian war, and I don't like to call it Israel-Gaza war. The Palestinian cause is in Gaza and West Bank and East Jerusalem and everywhere. Anyway, but I served more, and PAMA, I gave more passion to PAMA after I went to Gaza, because they change you and they steal your heart. So you leave Gaza, but something is left always behind with the people of Gaza. Yeah. Well, very good. I want to thank all of you for your time, for your service. I know the three of you want to go back if we have room, and that is the other thing. All people who went to Gaza, they want to go back. Amani, I know you asked me, and again, I want to, on recording, apologize that I cannot honor your request, but I will work hard on it. But we are limited with how many people we can take, and that is the other thing. That's another thing we need to call whoever has the power to make us send 50 people, not 10 people only. Make it safe there, so we can rent a house and move freely between hospitals. And nobody's going to the north now. A mission or two made it to the north, but the north is waiting for all the help from the whole world. Well, with that, I will conclude, and I want to thank every one of you, and have a good rest of your day. And thank you for your volunteer time and for your service and everything you do. Thank you.
So
Thank you
much.
for having us.
Thank you.
Ma salam. Ma salam.
Bye-bye.
Yeah, guys.